94.1 WHRP, today's best variety of R&B. Tony in the morning and DJ Primetime 256. Welcome to it. It is Wellness Wednesday with Dr. Whitney West, our favorite MD-PC. And Dr. West, hey, it is Wednesday. How you feeling?
I'm feeling good. How are you?
You're doing good. We're going to get over this hump. And today we're going to talk about something that's quite concerning, understanding ovarian cyst. Tell us what an ovarian cyst is.
So, a cyst in general is just a fluid-filled sac. For the ovary, this is when typically around a time of ovulation, we're talking about reproductive world here, the ovary puts out an egg, and that part of the ovary has to heal. And sometimes it heals over normally without any problem. Sometimes there's a little bit of collection of fluid, which turns into what we call an ovarian cyst. And that is very common in teenagers and young adults.
We're talking to Dr. Whitney West about understanding ovarian cysts. What are the common types of ovarian cysts?
So there are what we call functional. It means that ovulation happens and then you get this little tiny cyst. Or as we're preparing for ovulation, there are cysts that occur as that one, the best egg is produced to be released. So those are functional. Then we have what's the dermoid cyst, which is it's actually a little tumor. It has really weird things inside like hair and oil and teeth, and that will grow sometimes and will require removal of that. And then we have other things that turn into there are benign cysts, and then we have the cancerous ones. So
those are a lot of cysts to keep up with. I'm not the only one that heard her say teeth, right?
Yeah.
Right. Okay. Dr. West, keeping us up to great information in regards to understanding ovarian cysts. What are some of the red flags? How do you know you have an ovarian cyst?
First one is pain. During your ovulatory cycle, there is discomfort. Some women are more aware of their body functioning than others, but that midway through your cycle, you'll get that discomfort for about 2-3 days. Now, the problem comes is when that pain is severe and it persists. So
Mhm.
if you're having the pain that lasts and we call it 8 to 10 out of 10 pain, then you need to be evaluated because the cysts can grow, and once they get past a certain size, then they become dangerous and may require emergency surgery.
It is Wellness Wednesday, and we're talking with Dr. Whitney West about understanding ovarian cysts. How can you treat all these different types of cysts?
Well, it depends on what they are, and we can do testing like ultrasounds, MRI, that kind of thing to decide exactly what it is. How big it is will determine how it's treated. If it's small, less than 4 centimeters or so, then we're talking just watching and waiting. Just look at it, watch it, and maybe recheck it in 4 to 6 weeks and see if it's resolved. If we're talking 6 and above, then we need to manage that sometimes with surgery. If we're close to 10 centimeters, which is, let's say, like the size of um, a grapefruit,
Mhm.
then we're talking surgery, because that the heaviness of that cyst can cause the ovary to twist on itself, and then it cuts off its own supply of nutrition, and then we now have an emergency situation where we have to get that ovary out.
Discomfort, excruciating pain,
Hmm.
warning signs to get in contact with
Hmm.
your doctor, make an appointment to get examined. All that said, Dr. West, what's the best way to stay in contact with you?
My website is www.westmdpc.com.
And your parting words?
Empower Wellness. It's a journey, not a destination.